Welcome, everyone, to our healthcare adventure. I'm so glad you're here. If you're tuning in as a future biomedical equipment technician or a clinical engineer, this episode is especially for you. Today, we're pulling back the curtain on a world that most people only see from the outside, the culture of healthcare. Think of it as a hidden operating system that keeps hospitals and clinics running smoothly. So, what are we going to explore? First up, what is healthcare culture? We'll talk about what it's really like to work in this environment, how doctors, nurses, engineers, and so many others come together as a team to help patients. Then we'll move into how care is organized. Ever wonder who does what in a hospital or how all those moving parts stay coordinated? We'll look at how teams are structured and why following systems and processes is so important. Of course, we can't talk about healthcare without touching on privacy and rules. This is where things like patient confidentiality and HIPAA come into play. It's about trust, respect, and keeping sensitive information safe. And finally, we'll dive into professional and ethical issues. Healthcare professionals face tough choices every single day, and how they handle those choices says a lot about integrity, responsibility, and compassion. By the end of this adventure, you'll not only understand how the healthcare system works behind the scenes, but also where biomedical equipment technicians and clinical engineers fit into the story. Spoiler alert, your role is more important than you think. So buckle up, let's explore the culture of healthcare together. All right, now that we've set the stage, let's talk about our roadmap for today and what you'll walk away with after exploring the culture of healthcare. First, we'll start with basics, understanding health and healthcare. We'll look at how our overall well being connects to the way we get medical help. It's not just about fixing problems, it's about the bigger picture of staying healthy. Next, we'll tackle the question, what is culture? We'll break it down both in general terms and in today's world. Um, and here's the fun part, culture isn't the same everywhere. It shifts depending on where you are and who you're with. From there, we'll dive into the cultural competence. This is a big one. It's about how doctors, nurses, and yes, even engineers learn to understand and work effectively with people from all kinds of backgrounds. Then we'll compare three important ideas: culture, safety, and healthcare. We'll talk about how feeling safe in a medical setting is different from having a safety culture inside a hospital or a clinic, and why both of these matter. We'll also explore how different cultures affect healthcare. Think about it: language, traditions, beliefs all shape how people give and receive care. And that leads us to acculturation. That's just a fancy way of saying what happens when people from different cultures meet, mix, and learn from each other. Something that happens in healthcare every single day. Finally, we'll connect it all back to technology. Culture and health technology go hand in hand. The tools we design, the devices we use, even the way we share information, all of it needs to respect and reflect the cultural differences of the people we're serving. So that's a journey ahead. By the end of this episode, you'll see just how much culture shapes healthcare and why it matters for anyone stepping into this field, especially future biomedical and clinical engineers like you, to succeed. So let's dig into our very first big question. What is culture in healthcare? I want you to picture a big, colorful melting pot. Everyone brings their own unique ingredients, flavors, spices, traditions. Culture is like that mix. It's the beliefs, the values, and the ways of doing things that shape who we are and how we live. Now, when we zoom in on healthcare, culture takes an even deeper role. People's backgrounds, traditions, and lifestyles all affect how they see health, what treatments they must have, what they can trust, how they feel about going to the doctor, all of these things. So let's take an example. In Hispanic culture, family traditions, foods, and even natural remedies are often really important to health. A doctor who understands that might ask, are you using any herbal remedies right now? Not as a challenge, but as a way to connect and give advice that fits with what matters most to that patient and their family. And that's the key for doctors, nurses, and engineers working in healthcare, respecting cultural differences. And this isn't just a nice to have, it's an essential. It helps build trust. So what it does is it helps patients feel seen and understood, and in the end it leads to better care. So culture in healthcare, it's the human side of medicine, the part that makes care personal, meaningful, and effective. Let's pause for a moment and think about a simple question. What does it really mean to be healthy? The World Health Organization, or the WHO, has had an answer to that since way back in 1948, and honestly, it's a pretty powerful one. They say Health is a state of complete physical, mental, and social well being, and not merely the absence of disease or infirmity. All right, let's break that down. First up, complete physical well being. This isn't just about not being sick, it's about your body working the way it should, feeling strong, energized, and be able to do the things that you want to do every day. Next, mental well being. That's what's happening inside your mind. It means being able to handle stress, feel calm, find happiness, and bounce back when life throws challenges your way. And finally, social well being. Health isn't just about you, it's about your connections. Having supportive relationships with friends, family, and being part of a community all play a role in how healthy you feel. So, according to the WHO, health is kind of like a three-piece puzzle: body, mind, and relationships. When all three pieces fit together, you're not just free from illness, you're thriving. So far, we've looked at how the World Health Organization defines health, but guess what? That's not the only way to think about it. Other ideas of health go beyond the body and even beyond the WHO's definition. For example, Morandi in 2008 suggested that health also means feeling good about yourself and being satisfied with your life. In other words, happiness and self acceptance are a part of being healthy too. Now, the WHO also points out that health doesn't happen in some bubble, right? Back in 2011, they laid out some key factors that really shape our well being. First, the social and economic environment. Think about where you live, the people around you, your job, and even your income. Having a supportive family or a steady job can make a huge difference in keeping your health. Second, the physical environment. This is about the spaces you spend your time in: your home, school, community. Clean air, safe drinking water, and a safe place to live aren't luxuries, they're essentials for good health. And third, individual characteristics and behaviors. This part is about you, your genes, your habits, your choices, eating well, exercising, getting enough rest, and avoiding risky behaviors like smoking. All of these have a direct impact on your health. So when we put all this together, health isn't just the absence of disease. It's a mix of how you feel about your life, the support you have around you, and the choices that you make every day. All right, let's clear up some really important health terms. Disease, acute illness, chronic illness. These words get used a lot, but they don't all mean the same thing. Let's start with disease. Think of your body like a complex machine. Now, I'm not saying that just because I'm an engineer. Disease happens when something inside that machine isn't working the way it should. Maybe a part is broken, or maybe a system isn't running smoothly. For example, if your body can't process sugar properly, that leads to diabetes. And that's a disease. Something in the system is off, right? So now, what about acute illness? This is when you suddenly get sick, but only for a short time, and it's like a quick glitch in the system, annoying but temporary. The goal with acute illness is simple. You get back up feeling completely healthy. For example, like a cold. That's a good example. You feel bad for a few days, but with rest and fluids, you're usually fine again. Or think about a simple fracture, a broken bone that heals after treatment. Right? Acute illnesses come on quickly, and with the right care, they usually go away almost as fast. On the other hand, chronic illnesses, this is a long term story. These are health challenges that stick around, sometimes for years, sometimes for life. The focus here isn't on curing the illness completely, but on managing it so you can live as fully and actively as possible. Diabetes, for example, doesn't just go away, it requires ongoing care. Asthma is another one. It makes breathing hard, but with medication and avoiding some triggers, people can manage it. Even something like back pain can become chronic if it lasts a long time, needing regular treatments and certain exercises. So here's the big picture: diseases are the underlying problems with how the body works, acute illnesses are short term setbacks, and chronic illnesses are long term conditions that we learn to manage. Let's talk about two big ideas that are connected but not the same: health and healthcare. First up, health. Being healthy isn't just about taking medicine or visiting the doctor. It's shaped by so many parts of our daily lives. Think about it: what we eat, the water we drink, the safety of our homes, even our habits and routines. For example, eating good food fuels our body. Clean water and proper sanitation keep us from getting sick. Safe housing gives us comfortable, living and stability. And lifestyle choices like exercising, avoiding harmful habits, and managing stress. These are all huge pieces of the puzzle. Now let's shift to healthcare. This is all about the actions taken to keep us well, fix problems when they come up, and improve our overall quality of life. And here's something surprising: about 70 to 90% of healthcare actually happens at home with patients and families. That means things like following treatment plans, taking medicine the right way, and making healthy lifestyle choices are all part of the picture. Of course, the professional side of healthcare matters too. Doctors, nurses, hospitals, and clinics all form what we call the healthcare system. Think of it like a big team with a shared goal, helping people stay well and recover when they're not. That system has two main parts: structures like hospitals, clinics, and labs, and actions like the actual services, treatments, and care delivered by health professionals. So here's a big takeaway: health is influenced by everything around us: food, housing, lifestyle, environment, while healthcare is a combination of what we do for ourselves and the organized services provided by professionals. And together they create the foundation for living well. So let's take a step back in time. Imagine the United States in the early 1900s, a world without many of the vaccines or antibiotics we rely on today. Diseases like measles, scarlet fever, typhoid fever, whooping cough, and diphtheria were some of the leading causes of death. Now, the chart on this slide shows something fascinating. So, between 1900 and 1963, the number of deaths from these diseases dropped dramatically. But here's a twist: these big improvements started before modern vaccines and antibiotics were even available. So, take typhoid fever, for example. If you follow the dark blue line, you'll see a sharp drop in deaths well before treatments existed. So, what caused it? Public health changes? Well, cities began improving sanitation, managing waste more effectively. Clean drinking water became more widely available. Housing conditions improved. Together, these changes made it much harder for diseases like typhoid to spread. And it wasn't just typhoid. Measles deaths dropped significantly even before the measles vaccine came out in the 1960s. So, scarlet fever is another one. Scarlet fever deaths went down long before antibiotics were around. So, what's the big picture? Yes, vaccines and modern medicine are absolutely vital, but the first huge leap in improving health and life expectancy came from something bigger: society itself getting healthier. And when people had clean water, safer food, better nutrition, and less overcrowding, disease lost much of its grip. Public health, things like sanitation, clean water, and improved living conditions did as much to save lives as the medical treatments ever did. And who do you think brought all that sanitation, clean water, and improved living conditions? Engineers. Now, let's shift gears and talk about something that affects millions of people every day: chronic conditions. These are long term health challenges, things like diabetes, high blood pressure, or asthma that just don't go away after a week of rest. Of course, modern treatments are essential here. Medications like insulin or blood pressure pills can be life saving. But here's the key: managing chronic illness isn't just about writing a prescription, it's about building a system of care that supports people over the long haul. That's where something called the chronic care model comes in. Back in 1998, there was a person named Edward Wagner who introduced this framework, and it completely changed how we think about long term care. The model says, yes, good treatments matter, but the best outcomes come from looking at the bigger picture. So, what does that mean? It means coordinated action, bringing in community resources and policies to support people. It means organized health services that are easy to access. It means giving patients the tools and the support they need to manage their own health every day, day by day. And it means using information systems and technology to track health data and guide smart decisions. At the heart of this model is teamwork. Imagine a partnership: on one side, an informed patient who understands their condition and takes an active role in their care, and on the other side, a prepared healthcare team of doctors, nurses, pharmacists, and more, all working together with the exact same goal. And here's something we can't forget: health goes beyond the doctor's office. The community, social support, and even technology play major roles. Today, digital tools make it possible to manage long term conditions and handle short term needs at the same time. Helping patients stay on track and giving doctors better ways to monitor progress helps everyone. And so the big takeaway would be this: effective chronic care is like a symphony. Medicine provides the instruments, but it takes coordination, teamwork, community work, and technology to bring everything together into one big harmonious masterpiece. Let's talk about a really big idea, or at least what people say is a really big idea, and that's culture. Right? It's one of those words we hear all the time, but it's so wide and deep that it can mean a lot of things to a lot of different people. In fact, I've known people who say that they have no culture, and that is actually another, perspective of the culture. So we got to define what is culture exactly. According to the U.S. Department of Health and Human Services, culture is made up of all the ways people in a group think, act, and communicate. That covers everything from language, traditions, beliefs, and values. Think of it as a shared set of practices and ideas that shape everyday life. And so, if you belong to a group, you most likely have a group culture, and no one's actually without one. For example, it could be the foods a family shares during the holidays, the way a community celebrates special events, or even how people show respect when they talk to each other. All this builds into the culture. The National Library of Medicine takes it a step further, saying culture is also the patterns of behavior people learn and pass on in their communities. That means traditions, customs, and languages don't just appear out of nowhere. They're taught, they're practiced, and handed down through generations. Picture a traditional dance performed at a festival, or the way families mark a milestone like a wedding or a birth, or even the everyday language people use at home. All of that is culture in action. So, in short, culture is like a giant tapestry made of countless threads, language, beliefs, customs, traditions, all of that's woven together. And the more we understand culture, the better we can appreciate the richness and diversity of people's lives. Let's break down two big ideas that often get talked about together. That's culture and diversity. So, first, culture. At its core, culture is a set of shared beliefs and behaviors learned by members of a group. It shapes the way people talk, the way they connect with each other, and the customs they follow in daily life. For example, culture influences communication styles. Some groups might be very direct, while others lean toward more subtle, respectful ways of speaking. It also shapes relationships, how people build trust, how they show respect, how they maintain friendships, and of course, it's at the heart of customs and traditions. The holidays that we celebrate, the ceremonies that we hold, even the little routines we follow at home. Right? Culture groups can be formed in lots of ways: by race or ethnicity, like Hispanic or Asian communities, by gender, like men and women, or by nationality, like Americans or the French. Each group carries its own unique patterns. Now let's zoom out to the bigger picture. That's the bigger picture being diversity. Right? Diversity is broader than culture. It's all about the differences among people. It includes gender, age, education, religion, sexual orientation, and so many other qualities that make up each person. Right? What makes each person unique. Picture a company where the employees come from many racial backgrounds. They span across different age groups. They represent various genders and bring in different educational experiences. That's a diverse workplace, rich in perspectives and ideas. And so here's the takeaway: culture is about the shared practices of a group, while diversity is about the wide spectrum of differences that exist among people. Together, they help us see the value in what makes each of us unique and how all of those differences create a richer, more connected society. Let's zoom in on what culture means when we're talking about healthcare. According to the US Department of Health and Human Services, culture in healthcare is all about the ways people talk, think, and act when they're dealing with doctors, hospitals, clinics, and so forth. It's all about the traditions and values that shape how they receive and how they give care. For example, in Hispanic culture, there might be a specific custom about how families approach health, like how they use home remedies or how openly they talk about illnesses. And these traditions matter because they shape what feels respectful, safe, and trustworthy in a medical setting. The National Library of Medicine adds another layer to this. Culture in healthcare is also about the shared habits people learn from one another. It's the words they use, the traditions they follow, and the customs they bring into the clinic with them. So, again, a Hispanic family might use unique ways of talking about health that reflect their community's values. So, in short, culture in healthcare is about much more than medicine. It's the shared ways people think, the way they speak and act about health that shapes their traditions and beliefs. And when health professionals recognize and respect that, it opens the door to better communication and stronger trust with patients. Let's bring two big ideas together: diversity and culture, and how they both shape healthcare. First, patient diversity. This means recognizing that people come from all kinds of backgrounds, different nationalities, ethnic groups, races, and religions, and those backgrounds affect how we think about health. For example, again, I'm going to use the Hispanic community. A patient from a Hispanic family or a Native American community may bring unique traditions and beliefs about healing and illnesses. Doctors and nurses need to understand and respect those differences if they want to build trust and give the best care. Now let's flip the perspective to workplace diversity. Right? Healthcare teams themselves are often made up of people from all different backgrounds. In a single hospital, you might find doctors, nurses, and staff from Hispanic, Native American, Asian, or African traditions, all working side by side. And that diversity strengthens the team because it brings a wide range of experiences and perspectives. But diversity doesn't stop at people. It's also about organizations and culture. Inside a hospital or just a clinic, culture can mean a few different things. There's a safety culture, which is about making sure everyone is safe and careful. There's organizational culture, which reflects the shared values and practices that shape daily work. And then there's the idea of measuring culture, checking how well the organization is doing at creating a positive environment for both staff and patients. And finally, let's look at the health professional culture itself. This is about the differences between how doctors, nurses, and other professionals how they practice care, and it can include medical, surgical approaches, the standard treatments that we're familiar with, but it can also include traditional and alternative practices. For instance, Native American healing traditions or Hispanic herbal remedies may play an important role for some patients. So here's the bottom line about this whole thing. Patient diversity is about caring for people from different backgrounds. Workplace diversity is about collaborating across those differences. Organizational culture is about creating a safe and supportive environment. And professional culture is about the many ways health is practiced. Together, these layers remind us that healthcare isn't a one size fits all. It's about blending respect, collaboration, and understanding to provide the best care for everyone. Let's dive into how culture shapes the way people experience healthcare. First, there's the impact on equity. Not everyone gets the same quality of care, and sometimes culture is the reason. If a doctor doesn't understand a patient's traditions, language, or beliefs, the patient might not get the right treatment, or they might even feel ignored or disrespected. That gap can make a huge difference in health outcomes. Language is a big part of this. Imagine going to the doctor and not being able to explain what hurts. Spanish speaking patients, for example, they may need translators to bridge the gap. The same is true for people who speak Telugu or any other language that isn't the providers. So without support, communication breaks down. But culture isn't just about words. It's also about concepts of illness. Some communities believe illness has spiritual causes, while others may turn to traditional healers or herbal remedies. Meanwhile, Western medicine might focus strictly on biological causes and modern treatments. These models of illness shape how people seek care, how they follow treatments, and even whether they trust the system at all. That's where cultural competence comes in. This means health professionals actively learn about, respect, and adapt to different cultural backgrounds. And when that awareness becomes part of a patient care, it creates cultural sensitive care, care that fits the patient's world, not just the hospital's. And here is the thing about all this: culture shows up in many ways. Some examples can be geographic cultures. People from Southeast Asia often bring specific health practices with them. Religious cultures. Christian scientists may prefer spiritual healing, while Muslims may follow dietary restrictions or religious practices that affect their care. You have language cultures. Spanish or Telugu speakers uh, may need bilingual staff or interpreters to feel fully heard. Now, hopefully, I'm saying that right. Telugu, right? Ethnic cultures. Uh, Imagine if it's Romani, Turkic, Ukrainian patients, right, may each carry their own health traditions and expectations. And you might have some special groups as well. You might have deaf individuals who need sign language interpreters. People who are living on the streets often face very unique challenges. Adolescents, they also bring their own culture, their language, priorities, and concerns about health. So here's the big picture. When doctors and nurses understand a patient's culture, it's not just about being polite, it's about making care safer, more effective, and more respectful. Healthcare works best when it speaks the same language, not only in words, but in values, beliefs, and traditions. I believe in this 100% because I also use this in education when I'm working with students. Let's pause and talk about something at the very heart of good healthcare: understanding and respecting cultural differences. So, at its core, this means recognizing that people come from many different backgrounds, and with that comes some unique beliefs, traditions, practices. Right? No two patients or professionals are exactly the same. That's why one of the most important principles in healthcare is this: approach every person as an individual. Instead of assuming that everyone from the same culture thinks or acts the same way, we listen to each patient's personal story. For example, some cultures may have specific beliefs about blood transfusions, and others may view vaccines through the lens of tradition or religious teaching. When we listen carefully and respect those beliefs, patients feel seen, they feel heard and cared for. Now, is this doesn't just apply to doctors and nurses. For those of you stepping into the biomedical equipment technology field or clinical engineering, cultural respect matters too. And why? Because the technologies you design, the technologies you repair or implement are used by people, and people bring culture into the equation. Sometimes new medical devices are created with assumptions about the patient's need, but what if those assumptions don't match the cultural realities of the people using them? That's why engineers have to think inclusively, designing technology that truly works for everyone. And here's another point. Even in the engineering workforce itself, stereotypes can get in the way. People may assume only certain groups are good at or interested in medical technology, but the truth is talent and passion come from everywhere. Diversity in engineering teams brings fresh perspectives, which ultimately creates better solutions for patients. And the takeaway here would be, I would say respecting cultural differences isn't just about being polite, right? It's about um making care more effective, making technology more inclusive, and making sure every individual's voice is valued. Now let's shift from patients to the people who take care of them. Healthcare work groups. Picture a nursing unit, a busy clinic, or a hospital floor. These teams are made up of individuals from all kinds of backgrounds, different nationalities, ethnicities, genders, and personal experiences. That diversity isn't just a fact of life; it's actually a strength. When a Hispanic nurse or a Native American nurse or others from different backgrounds work together with respect and understanding, the team is stronger. The stronger teams deliver better patient care. The same goes for physicians, right? Doctors don't all come from one mold. They represent many genders, races, ethnicities, and every one of them brings their own story and perspective into the exam room. For example, a physician from a Hispanic background might bring cultural insights that shape the way they connect with patients, while a Native American physician might draw on their own traditions and experiences to guide their care. So you're probably wondering, oh, he's using a lot of Hispanic and Native American examples. Well, my background is Hispanic and Native American. So I figured it'd be a safe bet to go with that. All right, let's continue. The culture of professionals themselves. Just being a professional has its own culture. Right. So a nurse who respects a patient's traditional healing practices or understands the importance of certain foods in a patient's diet, that can build trust and create a care plan that feels right to the patient. It's not just about medicine, it's about meeting people where they are. And one more piece, right? Just culture. This idea about creating a fair and supportive environment in terms of healthcare teams, instead of punishing people for mistakes, a just culture encourages honesty, learning, and improvement. When staff feel safe to speak up, for example, patients get safer. You have higher quality of care. And to end this slide with the big picture, it would be cultural diversity in work groups makes healthcare stronger. It enriches patients' care by bringing different perspectives to the table. It encourages respect for both patients and staff. And with just a culture in place, it helps teams learn and grow together. All right, let's go ahead and continue with two very different workplace mindsets that can make or break a healthcare system. And we mentioned one of these, right? So we have blame culture and just culture. Let's go ahead and jump with blame culture first, right? So first, blame culture in this kind of environment, when mistakes happen, the first instinct is to point fingers, right? Who messed up? Who gets punished? And you can probably imagine what this does to people. It creates fear. Workers start worrying about what will happen if they make a mistake. Some keep quiet when they see problems. Others avoid speaking up, even if they have an idea that could make things better. And the result, you have silence. You have a lot of missed opportunities and no real improvement. If you compare that with just culture, this is a totally different approach. Instead of punishing people for errors, the focus is on learning. Workers feel safe to say, hey, something went wrong because um, they know management wants to understand and improve rather than blame. So, in a just culture, mistakes are seen as opportunities to fix processes. They provide better training, and what it ends up doing is strengthening the whole system. Again, the contrast in plain terms is that blame culture uses strict rules, fear of punishment, and leads to workers staying silent. A just culture is open, right? High in openness. There's a lot of trust that's built, and is a focus on problem solving. And in healthcare, this difference matters deeply. A just culture means doctors, nurses, and staff feel comfortable reporting issues and questions regular practices. They're encouraged to suggest improvements, and when that happens, patients get uh, better and safer patient care because the organization is constantly learning and evolving. When I used to do a lot of rounds in hospitals and I was auditing for safety for environment of care, meaning all like the engineering support stuff, at first, it seemed as if I was working against the clinical staff. They saw me as someone who might turn them in for something. And I said, no, 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 no. I am on your side. I'm the engineer for the hospital. I'm here to make sure that you get your job done right, make sure that you not everything's the way you need it, so that you don't make a mistake, and that way we don't get hit by some other larger auditing agency. And that type of back and forth with the clinical staff, knowing that they could trust me, I was on their side. I was there to hear what they had to say because I wanted to find solutions. I wasn't out there just to point fingers and blame people for this or that not going right or wrong. Um, I got a lot of work done. I got way more work done when I built that trust with everybody. All right, let's talk about what makes an organization truly thrive. So, in healthcare or in any field, there are certain cultural qualities that make the workplace stronger, safer, and more successful. And first up is a culture of innovation. In this kind of environment, new ideas aren't just welcome; they're encouraged. In some cases, they're required. Right? Creativity is valued, and employees are supported when they try new approaches to solve problems. And that kind of culture keeps an organization moving forward instead of getting stuck in old ways. Next is a culture of health. This one focuses on employee well-being. It's not just about patients being healthy; it's also about the staff. Organizations that promote wellness programs, not just simply, put out a flyer or an email about it, but they actually actively engage in it. They encourage healthy lifestyles and they create supportive environments are the ones where employees feel valued and perform their best. The third piece is culture of privacy, especially in healthcare. This is critical. It means protecting personal information, following strict confidentiality rules, right? Making sure patients and employees trust that their private data is safe. Then there's a culture of cost-effective care, right? This is all about balance, providing the highest quality care while managing resources wisely. And it's not about cutting corners, but about making smart choices so that money is used effectively without sacrificing quality. One of the most important properties, especially in healthcare, is a safety culture. Here, safety is the top priority, creating workplaces where accidents and errors are prevented and where staff feel comfortable reporting risk. Connected to that are the organizational correlations of safety, things like training programs, clear communication, leadership support that makes safety more than just like a slogan, what I mentioned before. It's got to be something of action. Again, none of this actually matters if you can't measure it. So that's where the measurement of culture comes in. So there's things like, and you might have experienced these surveys, feedback assessments, things that help the organization understand how well they're living up to their values. And finally, there's culture change, right? Sometimes an organization has to shift its way of doing things, adapting policies, training staff, and communicating new expectations. So culture change takes commitment from everyone, but it's how organizations grow stronger over time. And the big takeaway from this slide would be that the most successful organizations build cultures of innovation, of health, privacy, especially in healthcare, right? Cost effectiveness and safety. But these can apply to any organization. They measure how well they're doing, and they're not afraid to change when they need to. That's the big thing. That's how organizations create positive environments for both employees and the people they serve. Okay, something every healthcare organization depends on is safety or safety culture. And at its core, safety culture is it's a group level concept. It's not just about one person or one department. It's about the entire organization sharing the same belief that safety matters. When everyone agrees on this and works together, safety becomes part of the organization's identity. And what does that look like in practice? Well, safety culture focuses on formal safety issues, and that means clear rules, strong policies, and systems in place to make sure safety isn't left to chance. It also means that when safety concerns come up, managers and supervisors respond. Uh, Respond for one, right? And that shows that staff that safety is always taken seriously. A proper response is a little bit better, but just not any responses doesn't mean that. But the key is that safety isn't just the job of supervisors or a safety officer. So, in a strong safety culture, everyone actually contributes. Every employee, from top leadership to frontline staff, have a role in keeping the workplace safe. And culture shapes that behavior. In the best organizations, good safety practices are recognized and rewarded. That connection encourages people to speak up, follow safety protocols, and look out for one another. And it's just as important is the ability to learn from mistakes. Oh, big, big importance here. In a strong safety culture, errors, accidents weren't just swept under the rug or pinned on one person. Instead, the focus is asking what went wrong in the system and how can we fix it. That mindset turns mistakes into opportunities for improvement. And again, the final piece here is that stability. Um, Again, a real safety culture isn't fragile. It lasts. Right? It has to be sustainable. So even as organizations change, grow, or face challenges, that commitment to safety always holds steady. That stability, it endures over some time, uh, and it provides a consistent foundation for protecting both staff and patients. So stability would be key. Sustainability, I'll say. What does it really take to create a safe environment in healthcare? Because safety doesn't just happen, right? It's built piece by piece by the way the organization works every single day. Uh, so it starts at the top. That's what the saying goes, with management committing to it. When leaders and managers make safety a top priority, not just in words again, but in actions, it sets a tone for the whole organization. Staff knows safety isn't an option, right? It's a standard. So there needs to be explicit safety practices and behaviors. You need to have clear rules, clear procedures that apply to everyone, and clear expectations that are expected from everyone. From how to handle equipment properly to the right steps in an emergency, everyone should know exactly what to do to keep themselves and others safe. It should start at the top and it should be practiced at the top. Probably a better way of saying it. Again, rules only work if people are trained to follow them. So that's where safety knowledge and training programs also come into play. Every employee should receive the right training. And again, not just once, but ongoing. So safety becomes second nature. And let's not forget communication, safety communication. So if you want to have good communication, this just means that it's more than just posting rules on a wall. It's about sharing updates, encouraging open discussions, and making sure staff feel comfortable raising safety concerns. So when communication is open, problems get solved before they turn into accidents. When communication gets halted, one of the biggest policies I've seen where this happens is they don't want problems rising to the top. They tell the people at the bottom to handle the problems at low as possible. That sounds good, but if it hinders communication going up to the top, that is bad. Right. So communication, safety communication should never have any barriers or limits. Um, and then there's the foundation, right? Safety equipment and supplies. You need the stuff. Yeah, protective gear, safety tools, and the right resources needed. They need to be available, and they also need to be well maintained. So without the right equipment, even the best training won't keep people safe. And the big idea here is, or the big picture, a safe healthcare environment is built on leadership commitment, right? Clear practices, effective training, and definitely open communication. Right? Communication cannot be hindered. There cannot be any policy that hinders or punishes individuals for bringing things up that need addressing. Right. And again, at the very end, the stuff that you have, your equipment that's used for safety, that it needs to be reliable. Right. So when all of these things come together, patients and staff are protected, and the organization builds a climate where safety is part of everything they do. You can't have any personal agendas in these organizations because it will definitely contrast with the overall mission of the organization, and safety is one of them. Okay, so we've talked about culture in general, and we talked about culture within healthcare. Let's go ahead and get a little more specific now, and just because like countries or families have their own traditions, health professions have their own culture too. So when we talk about healthcare culture, we're really talking about the way doctors, nurses, and other professionals think about their jobs and how they work together. For example, in Western medicine, treatment often relies on medications or surgeries, but in traditions like Chinese medicine, the approach might include acupuncture or herbs, however you want to say it. And these different methods reflect different cultural ideas about what makes people sick and how to make them better. And even within Western healthcare itself, each profession carries its own culture. Nurses often see their role as caring for the whole person. They provide comfort, emotional support, and guidance. Doctors, on the other hand, might focus more directly on diagnosing diseases and prescribing treatments. And depending on where you are in the hospital, the emergency room, the surgery unit, or let's say a family clinic, the feel of the workplace can change completely. If you don't believe me, go to a labor and delivery and see the difference between that and any other room. So like, we want to bring this back to technology and culture, right? And so I'm going to do that by talking about clinical engineers. Where do clinical engineers fit into this picture? Their role is behind the scenes. But again, it's absolutely vital. Clinical engineers make sure that the medical equipment, the monitors, ventilators, ultrasound machines, infusion pumps, they make sure all of this stuff is safe, reliable, and ready to use. Again, it might not be the clinical engineer with their hands on the equipment. It might be a biomedical equipment technician. It'll most likely be a biomedical equipment technician, but clinical engineers are there to oversee that whole process. Right? They understand systems. So their work supports every corner of the hospital, from the ER to the ICU, and mainly is to ensure that technology doesn't get in the way of patient care, but it helps run smoothly. And the really important thing here is that culture isn't just about professions, it's also about patients and communities. So, for instance, I'll use Hispanic and Native American culture again. That's my background. In many Hispanic cultures, families play a central role in healthcare. So, a clinical engineer might need to explain how a piece of equipment works, not just to the patient, but also to their family. So, everyone understands and feels comfortable. In Native American communities, health is often seen through a holistic lens, healing that balances the mind, body, spirit, and environment. Clinical engineers working in these settings may need to be especially sensitive to how technology fits or doesn't fit within those cultural values. And again, the big picture ending this slide would be that healthcare is made up of many different cultures, and that could be professional cultures, specialties, communities, all of these interacting at once. And clinical engineers end up being the bridge between technology and patient care. And part of their job is to respect and adapt those cultural differences while keeping the technology safe, effective, and supportive for healing. Let's step back and look at the bigger picture. Health culture. So, in health culture, culture refers to the shared beliefs, values, and practices of professionals. So, doctors, nurses, engineers, and a whole lot more. Just like different communities have their own traditions, healthcare has its own. And within that, there are even several different subcultures. Take treatment approaches, for example. We mentioned this already, but in Western medicine, treatments might focus on medications or surgery, right? But in traditional practices like acupuncture, their approach may be very different, centered on balance, energy, or natural remedies. And both traditions are shaped by their cultural understanding of what illness means and how to heal it. Even within the same hospital, professional cultures can vary. So, nurses, they often focus on holistic care, treating not just the body, but the person as a whole. Doctors may learn more toward diagnosing and treating specific conditions. And the environment matters too. An emergency room might have a fast paced, high intensity culture, while surgery unit has its own rhythm and its own rules. Now, let's bring engineers into all of this, right? So, how do we connect clinical engineers into this? These professionals keep hospitals, especially the technology, the equipment, um, safe. They keep it reliable and they keep it ready to use. They're the ones ensuring that the heart monitors work, the infusion pumps run smoothly, and the imaging equipment is calibrated correctly. Not just this, but safely. Everything is safety is the heart of everything. And their work may not always be visible to patients, but it's just as critical for care. So when you're working alongside them or the biomedical equipment technicians, or even if they reach outside the hospital to work with biomedical engineers who design and develop technologies, right, who support clinical engineers, everything from like diagnostic machines to life-saving devices, they form a bridge between technology and the patient care, working closely with doctors, nurses, all this to keep healthcare moving forward. And here's something essential when we talk about culture. There's a sensitivity to culture, right? A cultural sensitivity. Um, and engineers don't just fix machines. They also work with people. So that means that respecting and understanding culture values is important for engineers as well. Again, for example, in Hispanic communities, family involvement in care, it's often central, right? In Native American cultures, holistic healing practices may shape how technology is received. And then just being culturally aware helps engineers communicate better and support care more effectively. And of course, none of this works without the safety culture. Like I said before, safety is at the underpinning of all of this. We don't do anything unless it's safe. So you have a strong safety culture. That means that you're going to have clear rules, proper training, open communication. I'm going to say that two or three more times. Open communication, and the right equipment. And it's about everyone in the organization committing to safety together. And again, that's very different from what we mentioned before, the blame culture, where mistakes lead to punishment and silence, or ostracizing or whatever. In a true safety culture, mistakes are treated as learning opportunities. They're approached head on. Um, so instead of fear, there's an openness, and that makes care safer for patients and workers. So health culture is more than just medicine. It's the blend of professional values, cultural sensitivity, technology, and safety. And for future clinical and biomedical equipment technicians, it's the environment where you'll make a real difference. And that brings us to the end of today's journey through the culture of healthcare and technology. We've explored how cultures shapes health, how diversity strengthens care teams, how safety cultures keep patients and workers protected, and how biomedical equipment technicians and clinical engineers play a vital role in connecting technology with people. I want to thank you, especially our future biomedical equipment technicians, our future clinical engineers, for joining me on this adventure. The work that you do matters, not only at keeping machines running, you know this better than anybody, but you also help create a safer, smarter, more compassionate healthcare environment. Culture isn't just something out there, it's something you build every day in the way you work, the way you respect others, and the way you design and support technology. So I want to say thank you for listening, thank you for learning, and thank you for stepping into a field where you can make a real difference. Until next time, stay curious, stay thoughtful, and keep building the future of healthcare.